And today we'll start with such topic as gram-negative Cauchy. And let's see what it is about. First of all, who can tell me what's the main difference between gram-positive and gram-negative bacteria? Okay. And it is the mostly easy answer, staining. In order to not say nothing is the best answer. But who will make this staining? Who will make this staining? Bacteriologist, right? Microbiologist. Will you become, who has a dream to become microbiologist? Raise your hand. Don't be so shy. I know how exciting it is to become microbiologist. So, okay. So, can you see? Your answer doesn't fit to anything you're gonna do in your life, right? So, when I ask you the question, what's the difference between gram-positive and gram-negative bacteria? The best answer is that answer that will be useful for you in your professional life. And probably, if not everyone here, most of you would like to be a curative doctor, treating patients, not sitting in the lab, right? So, for you, those who will treat the patient, what's the importance of knowing, of understanding the difference between gram-positive and gram-negative bacteria? Because I will repeat it again. I'm pretty sure I will need to repeat it again during other lectures. Here is the biggest part of microbiology you will need in your life: gram-positive and gram-negative. And understanding of the difference between gram-positive and gram-negative bacteria. Because all the bacteria we are studying are related to certain infections. Infections are leading to disease that you're going to treat. And in dependence on what kind of disease, what kind of infection, what kind of pathogen your patient will have, you will be the person who will decide the direction of treatment, with the type of treatment, and so on. So from this point of view, difference between gram-positive and gram-negative bacteria is extremely important, because these two main groups of bacteria in medicine are based on the cell wall structure. And what you should keep in mind, that the cell wall structure of any microorganism, any pathogen, is the main organ. The cell wall is the main organ that the bacteria has. Think about it. The cell wall gives to the bacteria shape, protection, nutrition, and division, multiplication. The second important organ is nucleoid, DNA. But the mostly important part is the cell wall. And if you compare a difference between gram-positive and gram-negative bacteria, here we have the picture only of gram-negative bacteria, but if you compare difference between gram-positive and gram-negative bacteria, you will observe that it differs in thickness, you know it, and in number of layers. Talking about gram-positive bacteria, it has 3 layers, and it's thicker than gram-negative bacteria. First layer in gram-positive bacteria is peptidoglycan. Second layer is periplasmic space. Third layer is cytoplasmic membrane. That's it. And the thickest layer, the biggest layer, is peptidoglycan. Is made of a lot of layers of murin. Here we have example of gram-negative bacteria. So it starts with outer membrane that is missing in gram-positive bacteria. Next, it has periplasmic space surrounding very tiny layer of peptidoglycan. So here and here we have periplasmic space. Here we have tiny layer of peptidoglycan. And the last one is cytoplasmic membrane. At all, we have 5 layers, but together they are thinner than 3 layers of gram-positive bacteria. Why it is that important to understand it for you and to know it as future doctors who are treating your patients? Because since bacteria has the main organ, the cell wall, main structure that will interact with antibiotics you will apply are present on the surface of the cell wall. And since the chemical and morphological structure in these two types of bacteria is absolutely different, in most of cases, the treatment also is supposed to be absolutely different. Did you get it? Different cell wall structure, different treatment. This is what you need to keep in mind about microbiology and about treatment in different bacterial infections. Next thing which you need to keep in mind in microbiology is how to make difference between all of these bacteria without learning them by heart. Because we have hundreds of known genuses, families, genuses, and species. So we have hundreds of families, millions of genuses, and billions of species of bacteria. And it's impossible to keep in mind all of them and to learn which is gram-positive, which is gram-negative, or even more to check it out every time, to stain it every time. Of course, the bacteriologist will do it in the lab because it is his job to make this diagnosis. But what do you need to keep in mind in order to make difference between these two main groups of bacteria? All the data you can find about this bacteria is encrypted in the genus name. Genus, species. Not all the time, sometimes you will need family name. But in most of cases you don't need family name. But in most of times you will need genus name and species name. Example, Staphylococcus aureus, Streptococcus pyogenes, Neisseria gonorrhea, Klebsiella pneumonia, Shigella flexneri, and so on. So first word is genus name, second word is species name. Clear? Okay. And by the way, when you make your thesis and you introduce some bacteria's names, when you introduce genus, species, name, all the time it is to be genus with a capital letter, species with a small letter, and all the time italic. Keep in mind, soon you will make your thesis. Okay? And it doesn't matter if you will not make thesis on microbiology department, anyways, you will observe in your thesis will appear a pathogen. You will have to name it somehow. So, How you make difference between gram-positive, gram-negative bacteria? Genus name. In the end of the genus name, if you have letter A, in 99% cases it is gram-negative. If it is any other letter, it is gram-positive. Clear? Staphylococcus? Positive. Streptococcus? Mycobacterium? Neisseria? Shigella? Salmonella? Vibrio? Exception. Exceptions you have to learn. How you learn it? We'll discuss it on the lecture about intestinal infections. Probably somebody already knows, right? Or forgotten. Never mind, it happens. So all the time you have the easy way to learn something if you like it. If it is boring for you, nothing will help you. Okay? So now you know that Neisseria genus is related to gram-negative bacteria. Good. Among gram-negative cocci, we have two main species from one single genus, is Neisseria gonorrhea, or also it is called gonococcus, that is causing infection called gonorrhea, and Neisseria meningitidis, or also it is called meningococcus, and it is causing, what does it cause? Meningitis, bacterial meningitis, exactly. Now, in dependence on what kind of infection we have, gonorrhea or meningitis caused by Neisseria, by gonococcus or meningococcus, they have some similar features, morphologic features and physiological features, and they have some differences. What is in common? First of all, they are diplococci. What means diplococcus? All the time they are arranged in pairs. That means that all the time they will multiply only on one axis. Unidimensional. We have bacteria that multiply in one direction. These are diplococci and streptococci. They're making pairs or chains. Bacteria can multiply in two directions and organize tetracocci. Everything is from till now, everything I'm discussing is from the last semester. On two planes, on two directions, tetracocci. 4. They can multiply in 3 dimensions. Sarcina. Did you remember it? They multiply in 3 dimensions. And they organize kind of cubic shape. How you keep in mind sarcina? If you know, in Romanian we have a word, sarcina. And this word means either pregnancy, either charge, either burden. Extra charge, extra burden, or pregnancy. That makes you 3-dimensional, makes you more voluminous, okay? So, sarcina is something more voluminous. not flat, not flat. Okay. And Staphylococcus, it multiplies in any possible direction. This is why it organizes kind of clusters, grapes. It looks like grapes because it multiplies in any possible direction. So based on genus name, you can tell about the bacteria a lot of features if you know all of these details, because everything is encrypted in the genus name. Its shape, coccus, spherical shape. Bacillus, bacterium, clostridium, spirochete, or anything else. Everything is encrypted, or most of data is encrypted in the genus name. Even gram-positive, gram-negative. Coming back here. So their spherical shape, gram-negative Neisseria, right? Diplococcus, spherical shaped or arranged in pairs, Neisseria, gram-negative. Non-motile, you cannot here see here any flagellum, but you can see here some pilae. Which is the function of pilae? Attachment, anchoring to the surface, which makes them extremely pathogenic, extremely virulent. Why? Because they attach very good to surfaces, including different mucous membranes, either central nervous system. They attach very good. They feel really comfortable in mostly warm places of our body. They're really susceptible to the environmental conditions. As a result, as soon as they get in the environment, it is almost impossible for them to survive. This is why gonorrhea is sexually transmitted infection. You need very close contact for transmitting of this infection. This is why if anyone tells you that he or she got gonorrhea by using some towels or sitting on a toilet or something, in 99.99% cases it's technically impossible. Okay? So you can believe this legenda only after you exclude all other more potentially possible variants. Okay? Because as somebody really smart told, everybody lies. Sometimes for no reason, sometimes for no reason. Right? So, and talking about meningitis, meningococcus, it spreads a little bit differently. It spreads through the air from nasal cavity to nasal cavity, usually by sneezing, and usually among little children. Now, everything I will tell you will be more related to clinic, since you are going to work in clinic, not in the lab. But please, when I tell you everything, try to connect your mind to the lab, because you will be that person who will prescribe not only treatment but also lab investigation. And based on lab investigation result, you will prescribe the treatment. So all the time you should be online with lab. So I tell you about clinic, you think about the lab. What does it mean? when you think about symptoms, immediately you should start thinking about the way you will prescribe the diagnosis, investigation, and treatment. Let's start with gonorrhea. First of all, it is STI, sexually transmitted infection. How do you think? Why gonorrhea is called gonorrhea? Which is the meaning of this word? Gonorrhea.
Producing.
Huh?
It's like when you're making one of the symptoms is like discharge.
Discharge. Okay, very good. So when you see, when you can hear the root rea, you are thinking about certain discharge. For example, we can have rhinorrhea, right? It's running nose, discharge from nasal cavity. It can be diarrhea, liquid stools. It can be what it can be also. Did you hear about amenorrhea, lack of discharge during menstruation, and so on? So when you can hear rhea, you are thinking about certain discharge, its presence or its absence. But it is about discharge. Okay, so we have the answer for the second part of the word. What about the first one? Gono. What means gono? Gonads. What means gonads? Reproductive organs, exactly. So gono, you probably observed that most of medical terminology is coming either from Latin, either from Greek. If we are talking about gono, this root and this word is coming from Latin. And it means the same word that in Greek is sperma. Do you know what is sperm? The same word, gono. So in Greek it is sperma. In Latin it is gono. And actually it means semen discharge. Now, is it correct naming or not? Opinions? Do we actually have in gonorrhea semen discharge as a symptom? Not really. Why? Fair enough. Because it affects not only men, first of all. It makes most of logic, right? It can affect both men and women. Now, why it is called so? The medical terminology sometimes is really old. The name gonorrhea also is very old. It comes from times microbiology wasn't known as a science and bacteria wasn't known that they exist. So some people, and being more specific, some men had kind of whitish discharge, usually in the morning, that have been misused with semen. People used to think this morning discharge is semen discharge, but actually it was pus that has similar aspect. Time passed, people discovered bacteria and studied a lot of infections, but the name remained the same. It is pus discharge. And why they also thought it is semen? Because in most of cases, gonorrhea in women is passing asymptomatically. Think about it. If we're talking about any other sexually transmitted infections, both men and women are representing quite similar risk as a source of infection. But when we are talking about gonorrhea specifically, in this very case, women are representing more risk as a source of infection, because as long as you have symptoms, first you treat because it bothers, and after that you are doing anything else. If you don't have symptoms, you are living your regular life with all activities, including sexual contact. And since sexually transmitted infections are mostly related to people with multiple partners, and we can argue forever, very, very long, who has more sexual partners, men or women, and probably everyone will be right. It doesn't matter which is your opinion, because in order to do it, you need another side. There is no way. And it is not like there is one man and all women are going to him, or there is one woman and all men are going to her. Never like this. As a result, it's quite similar. But when it is about epidemiological risk, you should think about more parameters, including presence of symptoms, because asymptomatic diseases all the time, or asymptomatic infections, are all the time much more dangerous from epidemiological point of view. Because as long as you don't know you're infected and you practice contact with a lot of people, you will spread it faster. As long as there is something that bothers you, you will treat it, and after that you will continue probably your lifestyle. Maybe you will change it, but probably no. As a result, actually, the issue is, or the solution is, paying attention to what you are doing. Because, of course, you cannot check everyone, but for sure you can know what you are doing in your life, right? What is really important, just as I told you, is that Neisseria are extremely susceptible to the environmental factors. That means that very often it's really hard to make bacteriological investigation. That means to take sample, to put it on culture media, and to find some bacteria. In case of gonorrhea, it is a little bit easier. In case of meningitis, it is harder, because they're really capricious to the environmental factors. As a result, since it is really hard to find them on culture media, especially in last period, the golden standard for lab investigation will be NAAT. What is NAAT? NAAT. Nucleic acid amplification test. Also, you know PCR, right? And PCR is one kind of, it makes part of a big group that is called NAAT. It is polymerase chain reaction. It is one kind of NAAT. But there are a lot of NAATs. Okay? And it is golden standard, because even if the pathogen will not survive, but you've been able to find some pieces of genetical material of this pathogen, there is a chance to amplify it and to find the positive result. So in last period, probably there is no infection. You cannot test with this kind of investigation. Moreover, it is really fast. It is much faster than cultivation of bacteria. So in most of cases, what we are doing, we've got the patient, we take some samples, and we start all investigation we can do. Bacteriological investigation, genetical, molecular biological investigation, and so on. Independence on symptoms. All the time, pay attention to symptoms. Symptoms will let you know in most of cases in which direction you should go. But the last word is after lab investigation. And please think about it, that this infection can affect not only genitalia, right? Because it seems humans' fantasy is unlimited, and ways to make sexual contact are really various. So sometimes it affects not only genitalia, but any other places, in dependence on type of sexual contact. So it could lead to inflammation of any kind of mucous membrane, in oral cavity, in genitalia, in anal cavity, and so on. Did you get it? And also, there is a kind of gonorrhea that is called ophthalmopathia neonatorum that affects eyes, because, and the answer is in the name, ophthalmopathia neonatorum. What does it mean? Since most of women are not having symptoms, she can be pregnant, she can give birth, and during delivery the baby has a contact with mother's vagina. And in this moment, the mostly vulnerable place in newborns are eyes. So if it was unexpected birth, without supervision, without all investigations before, then please keep it in mind, because you have much more chances to become parents than to become doctors. Even if you have a lot of chances to become doctors. It is not like you have very few chances to become doctors, but you have even more chances to become parents. So you will need it. You will really need it. Everything should be planified. You should be prepared for anything, because there are some minor details that could destroy your life. And you should think about it. You should understand it is about people's life. Not only in the moment you're entering in the surgical ward. It's about people's life. Also when you start dating. Also when you start doing anything else. Also when you finally start thinking about family. And good if you started thinking about family before she became pregnant, not after, right? And so on, and so on, and so on. So you are doing it in the right order. In this case, you have less chances to get in such situations, when you know nothing about this, about the health status of mother, of child, and so on. When we have a woman who gives birth without any extra data about her health status, there is a chance that she has gonorrhea, even without symptoms. In such case, for prophylaxis, few droplets of silver nitrate applied in eyes. It has it is very gentle solution that has bactericidal effect. And since Neisseria is very susceptible to the environmental factors, it is not really strong, but it is enough for Neisseria. So it kills bacteria from the very beginning. If it is boy, it is enough to drop only in eyes. If it is girls, if it is a girl, also in lower, right? Because there is also chance to have gonorrhea uh, to get infected with gonorrhea in the moment of delivery. Okay. Treatment is pretty simple, but since a lot of people are practicing having multiple partners, and since in different countries we still don't have good antibiotic administration control and drug administration control generally, a lot of people are already familiar with this infection. They know that some antibiotics like penicillin or others are quite efficient against this infection. And what do? They do what they want after they take some antibiotics to prevent infections. After that, they do again what they want, again antibiotics, again. What happens? Antibiotic resistance. Because everything that doesn't kill us mutates and tries again. By the way, this phrase in different way came exactly from my microbiology. As more a pathogen has contact with antibiotic, a gentle contact, not the final, as more chances we have for resistance. And since people are unstoppable in their pleasure, for them it is much easier to take from time to time some pills or some injections than to change their lifestyle. As a result, we have a lot of cases of antibiotic resistance. And again, here is the answer on the question why it is that important to make not only treatment but investigation before, because there is a very high chance nowadays that the patient, even if it is his or her first time they got gonorrhea, it could be already multi-resistant. So it is really important not to give the mostly popular antibiotic for this infection as soon as you got symptoms. But first you make lab investigation, you check for resistance, and after that you find the mostly efficient pathogen, the mostly efficient antibiotic. This way you will treat the infection completely and you will reduce the chance this very pathogen will mutate and will provide extra resistance. So keep that in mind. Resistance will make you sick and tired during your professional life. It doesn't matter what specialty you will choose. Antibiotic resistance will actually kill a lot of people. Talking about meningococcus. Now, everything I told you before, again, you think about symptoms and you think when you send the patient for which investigation and which treatment you give. Talking about meningococcus or Neisseria meningitidis, what is important to mention? Comparing to gonococcus, what's the difference between them? Meningococcus also has capsule. Capsule does not protect against environmental factors. Both gonococcus and meningococcus are really susceptible to the environmental factors. Moreover, even if meningococcus has capsule, it is even more susceptible to the environmental factors, and it is, in most of cases, almost impossible to multiply meningococcus, to cultivate meningococcus in the lab. You need to come to the patient to make this spinal punction, to collect CSF, and to put it on the culture media immediately near patient, and to put it in the thermostat immediately near patient, even not going from ward to ward. I'm not talking about different buildings or different parts of the city. You know, in different infections, you can bring sometimes even abroad the sample. If your country or your lab does not have any facilities for certain infections, in the beginning of pandemic, for example, first few samples, talking about COVID, first few samples from Moldova have been sent by DHL in Germany to make PCR and to confirm COVID, coronavirus infection. And next day or 2 days later, we've been receiving on email, fortunately backwards it comes faster than to the lab. Not because we didn't have PCR, but we didn't have all the kits specifically for COVID yet. Almost no one in the world had enough kits for PCR. As a result, in the beginning, it was so. In case of meningococcus, it doesn't make sense to bring the sample even in another ward. The best option is to collect, to put it on culture media, and to put it in thermostat immediately close to patient. So capsule protects against what? Against phagocytosis. The main function of capsule is protection against phagocytosis. So phagocytosis is really good and important measure of protection of our body unless the pathogen has capsule, because capsule has quite neutral pH and neutral structure that makes bacteria not 100% invisible for immune system, but almost. Some antigens like Fimbria, like pili, they are on the surface, but in the moment the the macrophages will swallow the pathogen, the immune system is not able to see it anymore. And capsule protects against digestion, against killing, against all the uh, uh, all the chemicals are applied against this bacteria. And finally, macrophages are dying and the pathogen is getting out. So in this period, in this moment, it becomes invisible for immune system. And it gives to the to bacteria extra time to multiply, to stay invisible for immune system, and to make it worse. What is the mostly dangerous about meningococcal infection? Mostly dangerous about meningococcal infection is the fact it spreads mostly among children. It could also affect adults, but the mostly affected are children first. Second, how it spreads. Usually, first symptoms are nasopharyngitis that affects mucous membrane of nasal cavity and pharyngeal membrane. Next, if it is not treated on time, and usually it is not treated on time because most of respiratory infections we don't take too much in serious. A little bit more we take it in serious in children, but not much more than ours. And being frank, we are used with all of these infections. This is the reason we don't take it in serious. Next stage, it passes into the bloodstream. If it is not detected on time, it can pass from bloodstream to the central nervous system and starting circulating in the CSF and affected central nervous system. As a result, we have specific symptoms for the first stage with nasopharyngitis, catarrhal symptoms. Second, bacteremia. Mostly it is extremely high fever, over 39, 40 and higher, which you cannot decrease with any antipyretic, paracetamol, ibuprofen, whatever. It doesn't kill the fever at all. And extremely bad intoxication syndrome, like being dizzy, typhoid status. Typhoid status is extremely high fever, being dizzy, headache, tiredness, general intoxication, and so on. And next, what happens? Meningeal symptoms. Meningeal symptoms include extremely bad headache, remaining extremely high fever, stiff neck, and it could lead to vomiting because compression of different centers in cerebellum can provoke different reactions, including vomiting. So if we have headache, stiff neck, and vomiting, don't think about food poisoning. Immediately start thinking about central nervous system affection. It is really important. Why it is that important to take action immediately? Because undiagnosed on time meningitis in over 80% cases leads to death. This is what you should keep in mind. And the reason of death is not only severity of infection. Often enough, the reason of death could be the fact that some doctors don't pay attention to the difference between gram-positive and gram-negative bacteria. Because gram-positive and gram-negative bacteria are treated differently. Why? What do you know about endo and exotoxins? What do you know about endo and exotoxins? There are two kinds of toxins released in different situations. When we are talking about exotoxin, exotoxin is a substance released by a pathogen during its life. In other words, it's a result of bacterial metabolism. Any living organism will consume something and will produce something. And it happens that some metabolic results, some metabolic products of some bacteria are toxic for us. So such substances we call exotoxins. Now, some bacteria, after their death, what happens to them? They're decomposing. They break in particles. And since they break in particles, it could happen that some particles of this bacteria could be toxic for us. And in most of cases, it is about gram-negative bacteria. Because this outer membrane that is made of lipopolysaccharides, in most of cases, in most of infections caused by gram-negative bacteria, and meningococcus is situated almost on the top, on the toxicity rate of gram-negative bacteria. For this reason, we have different types of antibiotics, because some antibiotics, they have narrow spectrum, some antibiotics have broad spectrum. Some antibiotics are for gram-positive bacteria, some antibiotics are for gram-negative bacteria. Some antibiotics are bactericidal, they have bactericidal effect. Some antibiotics, they have bacteriostatic effect. Some antibiotics could have both of these effects, in dependence on dose you apply. Now think about it. You have a patient on a terminal state with infection, with signs of sepsis, septicemia, and signs of meningitis. What do you want to do? You want to do extra, you want to give extra dose of antibiotic to kill bacteria faster, right? This is what you are thinking about first, when you don't think about difference between gram-positive and gram-negative bacteria, because in this case, if you increase the dose, it will give you bactericidal effect, and you with your own hands will increase amount of endotoxin that is released in the bloodstream, and it happens that the effect of from endotoxin will be over effect of exotoxin and any other factors of pathogenicity of this pathogen. As a result, by releasing a huge amount of endotoxin, you can lead it to toxic shock and to death. So a certain percentage of deaths could be related exactly to this situation, when you don't make difference between types of pathogens, types of infections, and types of treatments you should apply in different situations. What happens when you apply bacteriostatic antibiotics or bacteriostatic dose of antibiotic. What happens? You stop bacterial metabolism without killing them instantly. They will die one by one, but not all of them together. That will release a certain amount of endotoxin, but not that fast, and it will not lead to those dramatic results to the patient. And this is the main reason why it is extremely important to detect those infections as soon as possible and to make quarantine and investigation as soon as you find at least one case of meningitis, because if you detect it on the last stage, you don't have too much options. You apply a smaller dose of antibiotic and it doesn't succeed to kill the bacteria. You apply a big dose of antibiotic and it kills the patient. If you start gentle treatment from the very beginning, for example, you had one case of confirmed meningitis, immediately by emergency you find all contacts of this patient, of this person, with any other person. You detect all of them and we start making colonization in order to detect who got infected from this person, from this kid. And if you find those who are infected on the stage of the perfect is incubation period, or at least on the stage of nasopharyngitis, you saved a lot of lives, a lot of lives. If you find it in the end, after you lost few patients, it's dangerous. It's really dangerous for the entire society because, yes, it doesn't survive in the environment, but kids, children communicate to each other much faster than adults, especially when they get in the kindergarten, school, or even in hospital. They start communicating to each other much more. They sneeze and cough without covering themselves. It is almost impossible to force them wearing the mask. Come on, it is almost impossible to force adults wearing the mask, and even doctors, to force doctors wearing the mask correctly. Do you know how many surgeons I saw in my life covering only their mouth? Meanwhile, uh, a huge amount of population in the world are lifelong carriers of Staphylococcus aureus in the nasal cavity. So you treat you make surgery and you harvest the best you think, and directly in the surgical wound. But talking about kids, it's almost impossible to control all of their contacts, including the fact they try to taste everything, they try to lick everything, you know it. You know it on your own experience while being children. Look at any surface and I promise you, you know how it is on tongue, right? Glass, rocks, sticks, doors, floor, ceiling. How can you know it? Look there and you know how it's on tongue, right? Because all of us, we did it. So it is really vulnerable period of time for children. This is why it is extremely important, including being correctly informed about vaccination. And if there is a doctor, if by chance there is a doctor who is against vaccination, he or she have chosen a wrong specialty. Doctor against vaccination shouldn't practice. Anti-vaxxers among medical staff should be nonsense. Otherwise, we are doing something wrong in our life. It is really important because it is the mostly vulnerable period of our children's life, and we leave them absolutely without any protection. It doesn't make any sense. This is why, please think about it. It doesn't matter in professional life or in personal life. You'll certainly need it.